If you are in your 60s and wondering whether masturbation is still safe, normal, or even healthy at your age, let me begin by telling you something clearly and confidently as a doctor. Sexual health does not expire at 60, and safe self-stimulation, when done correctly and in moderation, can be a completely healthy part of aging. But it must be approached differently than in your 20s or 30s because your body has changed, your circulation has changed, your skin sensitivity has changed, and sometimes your medical conditions have changed as well. Today, I am going to guide you step by step on how to masturbate safely in your 60s, what mistakes to avoid, what warning signs to watch for, and how to protect your heart, prostate, pelvic muscles, and emotional well-being in the process. So stay with me until the end, because the third safety principle I will share is the one most seniors ignore, and that is where injuries and complications often happen. Before we begin, take a moment to like this video because open and medically guided discussions about senior sexual health help remove shame and protect well-being. And in the comments, simply write your age and whether you believe sexual health still matters after 60, because I read your comments and guide many of you personally. Now let me establish something important. Masturbation itself is not dangerous for healthy seniors. In fact, moderate sexual activity may support mood, improve sleep through endorphin release, and help maintain blood circulation in pelvic tissues. However, the how matters more than ever after 60. First, understand that arousal may take longer. Erections may not be as firm or as quick, and vaginal lubrication in women after menopause is often reduced due to lower estrogen. Rushing the process increases the risk of strain, discomfort, or even small injuries. Safety principle number 1. Slow down and allow adequate arousal time. This reduces friction-related irritation and cardiovascular strain. For men, forcing a quick erection through excessive manual pressure can damage delicate tissues, especially if you have diabetes or vascular disease. Gentle stimulation is key. For women, using adequate lubrication is extremely important because vaginal tissues become thinner and drier with age. Water-based or silicone-based lubricants can prevent microtears and discomfort. Never use household oils or substances that are not designed for intimate use because they may cause irritation or infection. Now, safety principle number 2. Pay attention to your cardiovascular status. Sexual arousal increases heart rate and blood pressure slightly, similar to climbing 2 flights of stairs. If you can climb stairs without chest pain, severe breathlessness, or dizziness, you are usually safe for moderate sexual activity. But if you have unstable angina, recent heart attack, or uncontrolled high blood pressure, you must consult your physician before engaging in sexual activity, including masturbation. I have had patients who were unnecessarily afraid after minor heart events, and after proper evaluation, they resumed safely. Fear alone often causes more harm than the activity itself. Now here comes the most overlooked safety principle. Avoid excessive force or aggressive techniques. As skin ages, elasticity decreases and healing slows. Rough handling can lead to bruising, swelling, or small tears. Men on blood thinners are especially at risk of bruising. Gentle, controlled movements are safer, and frequency should be moderate. There is no medical requirement to masturbate daily. Balance is important. Now, let us discuss prostate health because many men in their 60s worry about this. Regular ejaculation may help clear prostatic fluid and is associated in some observational studies with lower risk of certain prostate conditions. But this does not mean abstinence causes disease. What matters is comfort and overall health. If ejaculation causes severe pain, burning, or blood in semen, seek medical evaluation. These are not normal and require assessment. For women, regular stimulation can increase pelvic blood flow, support tissue flexibility, and help maintain pelvic floor muscle tone, which indirectly supports bladder control. However, if you experience persistent pelvic pain, bleeding after stimulation, or severe dryness not relieved by lubrication, consult a healthcare provider. Now let us address mental health. Sexual expression, even solo, can reduce stress hormones and promote relaxation. In seniors who are widowed or single, masturbation can be a safe and private form of sexual expression without risk of sexually transmitted infections. However, it should not replace social connection or become compulsive. If sexual activity interferes with daily responsibilities or causes guilt and distress, emotional counseling may be helpful. Another important safety factor is hygiene. Wash hands before and after. Keep nails trimmed to avoid scratches and avoid sharing devices unless properly sanitized. If you choose to use sexual wellness devices, ensure they are body-safe materials and follow manufacturer instructions. Never insert unsafe objects. Now let me repeat something clearly. Masturbation does not weaken your body, does not drain vital energy permanently, and does not cause blindness or nerve damage. These are myths. But dehydration, uncontrolled diabetes, smoking, and poor circulation can affect sexual function. Therefore, maintaining overall health supports safer sexual activity. I remember a 70-year-old patient who thought his reduced erection strength meant he should stop entirely, but after addressing his blood sugar and starting light exercise, his function improved and he regained confidence. Your sexual response reflects your overall vascular and hormonal health. Now let us talk about medications. Some drugs for blood pressure, depression, or prostate enlargement can affect libido or performance. If you notice sudden changes after starting a medication, discuss it with your doctor rather than assuming aging is the only cause. Do not self-prescribe herbal supplements claiming instant enhancement because some interact dangerously with heart medications. We are nearing the most important reminder: listen to your body. Mild fatigue after orgasm is normal. Severe chest pain, dizziness, or prolonged painful erection lasting more than 4 hours is not. Seek medical help immediately in such cases. Moderation, gentleness, hydration, and awareness form the foundation of safe sexual expression in your 60s. If this discussion is helping you feel more informed and less anxious, take a moment to like this video and comment "confident aging" below, because removing stigma allows healthier lives. Now reflect honestly. Are you avoiding sexual expression due to fear or misinformation? Or are you engaging without paying attention to safety? Balance is key. Sexual health is part of overall health. It deserves the same calm, respectful attention as diet and exercise. You are not too old for pleasure, but you are wise enough to approach it responsibly. Before we conclude, remember that open communication with your healthcare provider about sexual concerns is normal and encouraged. Doctors are trained to discuss these issues confidentially. If you have stayed with me until now, I appreciate your maturity and openness. Take a moment to like this video so more seniors receive medically accurate information. And in the comments, share whether this guidance made you feel more confident about your body. Subscribe and turn on notifications because I will continue sharing doctor-guided advice designed specifically for seniors who want to maintain strength, heart health, hormonal balance, and dignity in every stage of life. Aging is natural and safe. Informed choices allow you to age with confidence and comfort. I will see you in the next video.